It is a pleasure to be here. This is an extremely exciting project. I think what we're doing here is groundbreaking, and I think it is critical not only to improve how we deliver services to people in the territories, but to try to make sure that we can afford to continue to deliver those services.
I think the original idea here was to find a way to train in a very short period of time a large critical mass of decision maker and practitioners in using evidence-based for problem solving and decision making.
So we have 10 people on our diabetes team. We have 6 in renal care.
The idea came that maybe the best way would be to get practitioners and clinicians and managers to work in a participative process in actually solving a real issue, an issue that they were facing in their actual day-to-day practice.
My name is Ted Blondin. I live in Bechico, 110 kilometers out of Yellowknife on the shore of Marion Lake, and I'm a diabetic.
It's been a fascinating process because it's unlike, I would say, unlike anything that we've ever done before in the Northwest Territories.
We need to be working with the teams, the pilot teams, to be...
The people in the room really needed to be all part of this process. There's complex problems that they're trying to address around how do we provide the services that the people here in the territory need. And so you need that perspective from the frontline nurse, the family physician, the nurse practitioner, the folks at the dialysis unit, the physiotherapists, all of the professionals, as much as you need the folks who are responsible at an administrative level, the managers, the directors. So really what we were able to do was to get in one room people who are responsible for the delivery, the financing, the management of health services in the territory. And that's been absolutely critical.
My name is Evelyn Blondin Forrest. I live in Yellowknife and I'm dealing with depression.
Change management in healthcare is very challenging. It's complex. And one of the things in change that we do understand is that you need to have that vision. You need to have concrete evidence.
You have to consistently use the same terminology.
And you need to have a solid core group.
And I think you can, because I know they're already
that will be the champions to move the change forward and make it happen.
It's having the community people a part of.
Getting people with involvement from people throughout the system, frontline providers, managers, senior leaders in the system, and starting with looking at really identifying what were the problems that we needed to solve and what was the evidence telling us about the best way to approach solutions to those problems.
My name is Larry Sanger. I'm from Yellowknife. I've been going through dialysis treatment for 17 and a half years.
I think the lessons learned, both for the territories in how they do have to work together. This can't be left to one particular authority or one particular provider group, that you do have to have a vision and a plan for a full territory because patients move back and forth. That's very important to the rest of Canada. There's learnings in that, how to do that. But the innovation, the unique way that this was planned and attacked and developed, I think again fits with the discussions anyway right now in Canada on health system sustainability. Sustainability not just about money, but better patient outcomes, quality care, access.
What you guys did well was go right into sort of the indicators, right?
And also to really take healthcare in Canada to that next level.
Is to have a database.
It's going to fit very nicely into the innovation strategy, and I think really needs to be looked at by others that are looking for innovation.